So today we're going to be talking about a really important topic on how, really what the secret that I use for even for my own ADHD, as well as for my patients that I work with that have ADHD, and really the secret of how you thrive with your ADHD. Because this is something that a lot of people think that isn't possible. I'm living proof of it. Like I said, I have ADHD, grew up with it, struggled a lot as a kid, especially academically. Also have dyslexia. And so I had a lot of challenges growing up. And it wasn't until I was in college that I had to discover these things I'm going to share with you today that now I use with all my patients and clients. And I had to discover what was really internally wrong from a more biochemical perspective versus just using a stimulant medication. Because medications weren't working for me. It actually made me feel like more like a zombie more than anything. I mean, it helped me kind of focus, but then it was really inconsistent. So it made things just more difficult. And I sought out other functional medicine doctors to see, okay, what is causing me to not focus? Why can't I stay motivated and driven? And why do I struggle so much in school? Why do I have all this anxiety? And why am I also having this low energy at a younger age? And so, really, what it came down to, and what I do with my patients now, or doing this for over the past 10 years, is the first thing and like the secret to really thriving with your ADHD is that you have to really first discover the problem. Now, obviously, there's like, well, I have ADHD. Well, yes, but are you having those symptoms? Why are you not focused? Why is it very inconsistent? Why are you not present? Why is your boss and your spouse, significant others, family members complaining so much because you're not so present? Why do you have a hard time initiating tasks or finishing tasks? Why are you starting to have memory issues? Right? All these questions, why, and your doctor's not able to explain it to you. And the biggest thing that I have seen is because your doctors aren't running any kind of labs. They're just not. And that's the first thing that I ever want to do is to run labs so we can see what is actually causing these symptoms. And so the very first thing that I usually like to test and to check for when we're looking to see what's going on is to look at neurotransmitters. Now, a lot of people are like, oh, can you test neurotransmitters? You can throughout the body. There isn't any testing you can test specifically just to the brain, but guess what? 90 to 95% of our neurotransmitters are made in the gut. And so I like to look at the body throughout the entire body to see where those imbalances are of your neurotransmitter levels. And this will test things for like dopamine, serotonin, GABA, norepinephrine, all the different types of neurotransmitters to see, okay, what is truly going off. Hey, how's it going? UI Health. Sorry, just to interrupt there. So if you have questions, please do put it in the chat for me. I do want to make this interactive. So if you have questions, go ahead and put them in the chat. But I just want this as a discussion because also really just kind of understand this whole process. Let me go and pull up my whiteboard here. So first thing, if I can give me a second. Come on, pull up. There we go. So first thing I mentioned is like the starting point. So if this is kind of a journey to the secret. So the starting point that you want to go to is usually I like to test for neurotransmitters. Okay. So neurotransmitters to really see, okay, what are those specific neurotransmitter pathways that are off? Is it dopamine? Is it serotonin? Is it GABA? Like, what are the things that we need to identify that is the issue? Once we identified that, there's a few other things that I usually like to test for too, in order for someone to thrive with ADHD, because it isn't typically just neurotransmitters that are off. Another one that's really good to be that I like to test is cortisol. And I like to test this throughout the day, not just one time reading, but actually throughout the day to see where it's dipping and where it's spiking throughout the day. When we can test that, then we can see, okay, now we know why you have low energy, but also why you have maybe high stress, why it's disrupting your sleep with your ADHD. I also like to do a hormone panel. Switch over there. So looking at hormone panels. And generally this is going to be like looking at testosterone, estradiol, progesterone, DHEA. Those are things. So once I get these test results back, then I know exactly what's off from definitely a hormone and neurotransmitter perspective. And this is where we start to execute. Our next step here is treatment. Okay. Now, the treatment isn't just going to be supplements, but it is going to be, yes, very customized supplementation, but also customize very specific food and nutrition. And what I also will say that to have it become long lasting, like here's a really big secret when it comes to thriving with ADHD. When you start changing your body chemistry and having the right targeted supplements and nutrition, you're able to execute better and more efficiently on the lifestyle habits and routines that you do need to establish. And that's going to give you the long lasting results. It's not the supplements, it's more the food and lifestyle changes that are going to make the big difference. But as you start implementing this, then it's more effective to implement the lifestyle changes. What do I mean by lifestyle changes? Well, it's establishing habits and routines. So, for example, getting better quality of sleep, actually building up good habits and routines of having good sleep ergonomics, of going to bed on a good time, actually getting rid of the phone and having light exposure before going to bed, making all these little adjustments and implementing it effectively because now your body chemistry has changed more that you can implement better. It's also the different brain hacks, being able better with your time management skills. There's a lot of tools that you could use, but it becomes more effective when the body chemistry has changed. Is this making sense? So, because like that's really what has to be established here in order to execute. Now, once we've done that, before even this step, so I forgot to mention. So even in this process, usually when we are testing this, it takes time to get test results. Typically, using a different color here, I'll use pink. Actually, let's use green. We will need to optimize digestion. Now, why this is important, even if you do not have digestive issues, most people do not have an optimal working digestive system because the gut, like I told you, 90 to 95% of our neurotransmitters are made in the gut. So if that's not working optimally, guess what? The treatment that you're going to be implementing is not going to work optimally. So I like to focus on this to making sure that your body is breaking down the foods properly and that your body's absorbing the nutrients properly that it needs to. So that way it's not only feeding the body, but it's also feeding the brain. So that way you could thrive with your ADHD. So as those things are happening, we start seeing clarity of mind starting to improve. We start seeing energy start to improve. We start seeing brain fog starting to dissipate more. And then when we implement this treatment right here and the lifestyle things becomes more effective, efficient because the foods and the supplementation that you're taking, your body, your digestive system, which is basically the factory that breaks down everything, is working very effectively. So it's making sense so far. Let me know in the chat. Let me know if like there's anything that's like not making certainty. Question here is I'd love to hear your thoughts on rumination and obsessive compulsive type symptoms. So yeah, with rumination and obsessive compulsive type symptoms, it's very common with ADHD. It's what we call like additional comorbidity issues. And when you are ruminating, a lot of times that might be a deal too because you have also a general anxiety disorder as well. And so when you have this combo of ADHD and anxiety and maybe a little bit OCD, it's because there's imbalances typically with the neurotransmitters. Sometimes there can be some issues with hormone balance because hormones can also make us ruminate, and also be obsessive too, depending on the circumstance. But those are usually the things that usually we need to kind of address there specifically. But good question. Okay. So now the next step when it comes to really the secret of thriving with your ADHD is once we've established now balancing out neurotransmitters, balancing out your cortisol, balancing out the hormones, and things are now working more productive and efficiently, and you're more focused. I usually like the next step I like to take is going more micro. So looking at things at more micro level. So this is usually looking at things more in depth where we look at more like vitamins, minerals, amino acids, and antioxidants. The purpose of this is because these are really the ingredients. So the ingredients that help make things like the neurotransmitters, different hormones, different also a lot of functionality through our organs and our brain and our nervous system that require lots of different micronutrients. And if any of those are deficient, it's like you don't have fuel. So when you don't have fuel for these things in our body, in our brain, our nervous system, it's not going to work very, very properly. Okay. So then once we get those test results back, then we implement those treatments at a very high dose, a mega dose when it is deficient. I don't just give random supplements or vitamins and minerals if you're not deficient. But if you're deficient, then yes, then I'll specifically want to use a very high mega dose that's going to help get results. Now, once we've established that, this is usually when we'll see our patients and clients doing really well. They're thriving with their ADHD. They have the focus, they have the motivation, they're more present, more clarity of mind, they're more calm, getting better sleep quality. Those things are great. The thing is, though, people miss this step. Like they might get some great results with either supplements and medications, I guess, for that matter. But the thing is, I'm all about like not just getting just the results, but long lasting, impactful results. In order to do so, usually there's other things we have to do internally with the body. And at this stage, it's things that we're exposed to on a daily basis, like the foods that we eat all our life, the environment that we live in, and the air that we breathe. It builds up toxicity. And these are things that are chronic in our system that cause major issues for flare ups. So you probably experienced like randomly, like let me know in the chat, like where you have had flare ups of like all of a sudden you were really tired, or you got a migraine, or you all of a sudden, had a brain fog moment, or, like, or your focus is way off. Like these are things that can cause flare ups randomly because they're more chronic in our system. So at this stage, I like to put my patients through a cleanse. And usually I like to tailor this and cater this depending on the individual of what we're trying to accomplish and also how far I can do, how intense I can do the cleanse. But usually at this stage, the body has already been prepped because I filled all the holes in the gaps of the imbalances. And so now we can put the body through a deep cleanse. And this is one of my favorite things to put my patients through is because this is where we're getting rid of all the toxicity. And a result of it, you're going to see a lot more clarity of mind, focus, peace of mind as well. You have this peace of calm mind. I actually just recently got off of one not too long ago, and I was just very peace, and my kids weren't triggering me. Like I was just fine. And normally I feel a lot more clarity, more energy, more vitality. Those are things I just love about this whole process when you go through a deep dive cleanse. And then from there, once we've done that, this has really helped solidify to help have long lasting, impactful results. But we're not done just yet because the next thing that we need to implement is to look at specifically what has worked, right? We got to retest the labs and see, okay, what worked? Like what improvements did we see, especially in our biochemistry numbers? And where do we still need to optimize just a bit further? Because if we can do that, then we can have consistent results and always checking in and retesting and seeing, okay, what adjustments do we need to be making and still optimizing even further. And then it kind of just, it's this whole process of like retesting. And then I still like to encourage doing cleansing pretty frequently. So we're kind of almost like we're repeating this process. back and forth. Okay. So we're just repeating the process. And this is how we start to thrive with our ADHD is because we are checking in with testing to making sure that our levels are not going way off. And we're starting using systems like cleansing because again, we can't get away. We can eat as best as we can, but even the air that we breathe, the environment we live in, we still will have toxicity. So it's good to do this consistently. I like to usually doing a cleanse like at least once a year, typically with people, and even for myself to have that consistency. So let me know if this makes sense. If you have questions on that, but like if you want help on any of this and like want me to really tackle your ADHD situation and help you thrive, you can click on the link in the description below. It will take you to where you could actually book your first appointment with me. It's a 45-minute appointment. I do heavily discount it for your first initial appointment. So that way I could dive deep into your medical history, just like if you were to go to your doctor for the first time. We go over your medical history, determine what we need to implement, and then what kind of labs we need to do to execute on, and what kind of program structure to help you achieve that. So if you want my help on that, you can go ahead and click on the link in the chat or in the description or in the chat. So thank you guys so much for attending, and I'll see you guys on the next live stream. Thanks. Bye.